Hi. So I'm here with Dr. Ruth, who is a gynecologist here working for MSF. We've just finished a mobile clinic in Barangay 71, providing cervical cancer screening in the very new mobile van, which has only had one previous outing. This is the second time it's been out. And Dr. Ruth is kindly going to show us around the van. So hopefully this works.
Okay, so this is our mobile van. So currently it's being cleaned because we just finished our second mobile activity. So usually this area, this small table, this is where we do the consultation, and this is where we do the interview, like asking some questions and pertaining to first the general information of the patient, and then to the obstetric and menstrual history, then eventually up to the sexual history. So where we can probe more on if there are a high risk for having a cervical cancer. Okay, and then in this corner, this is our small changing area. So usually it has lights on, but since the engine is not on, so the lights are all off. So this is the small changing area where the patients use to change to a clinic gown, and there's also a small portable toilet. So patients can use it when they need to go or when they need to pee. So after the patient's being interviewed and after they change, this is the area where we do the cervical cancer screening. So this is the bed where they usually lay down. So initially we do a physical examination from head to toe. We check everything. We do breast examination as well as abdominal examination. And after which they are asked to do the dorsal lithotomy position uh, to undergo the cervical cancer screening, wherein we do either VIA or visual inspection using acetic acid or pap smear, whichever is indicated with the patient. And then this is usually the area where we put out all the instruments and all the materials that we need to use. This is the small. This is the sink for the hand washing area, and the cabinets where we usually this is just emptied out, but this is where we put the medicines, the materials, and everything that we need to use, like the cotton swabs and the vinegar, as well as the slides if we do pap smear, as well as extra sterilized cotton balls. And we put here some medications if we concurrently see a patient that have STI symptoms. So we keep some antibiotics here, and we also keep pain medication, wherein we give it to the patient if she undergoes cryotherapy. Okay, and then this is the CO2 tank. This is where we attach the cryo machine. So for the moment, we just put it here. But then after some time, when we improve the whole setup, we are planning to have the cryo gun be wall mounted here, and then just connected on the other side. There's another CO2 tank there. So this tank would be removed and it be more spacious. Okay, and then this is also designed by the logistics team as we had this planning stage in the initial planning stage that we wanted the light to be wall mounted, so it be not be hampering the patient if they are going to lie down and do the dorsal lithotomy position. So it's wall mounted and it's adjustable. The gooseneck is very long, it's very flexible, and the light is actually the light is adjustable also. You can dim it or you can adjust it to the brightness that you need to be able to see the cervix more clearly. So
Thank you.
okay, that's the whole tour. So I hope you.
It's petite, but it's perfect, yeah?
So I hope you had a little idea on how we do things in this very small and compact, but very useful and very important mobile van for us. So we do this to places which are far from our clinic. So we hope to reach them rather than them going to the clinic. So Thank you.
Thank you.
Good afternoon.